Welcome to Dental XP. A lot of times people ask, why implants? And if you take a look at this animation of a fractured tooth, you'll notice why people suggest implants. We get resorption immediately of the ridge. Many people in the past have decided to go ahead and prep the adjacent natural teeth, destroying the natural tooth structure in order to facilitate a very quick and efficient 3-unit bridge. You'll notice that there are some risks with doing something like this. It's clearly shown on this animation. Even if you have a well-fitting bridge, over time we do have resorption of the ridge over the extracted tooth, especially when we don't do socket preservation, sometimes recession over the adjacent natural teeth. Sometimes patients don't take care of their bridges and we get leakage and decay forming under one of the key abutment teeth, in this case the right central incisor, that leads into the nerve, causing a root canal. Obviously, this can further complicate things as the path of the infection travels up to the apex of the root, causing an apical abscess, an endodontic lesion. This lesion can worsen over time, destroying more bone, and of course weakening the tooth, causing possible fracture of the root. All this are possible complications that patients should be made aware of with routine crown and bridge dentistry. Eventually, through a fracture not treated, suppuration and pus and a fistula form on the gingiva, causing a worsening of the gingival recession and bone loss on the labial plate. This forces us now to retreat this area. What's another possibility just to avoid implants? Well, if we don't do anything to the socket and we just place a little bit of bone in there, then we're going to have to be forced to go ahead and prep more teeth, destroying more tooth structure, in this case 4-unit bridge, prepping the 2 lateral incisors. This can eventually lead, because of the weakness of these 2 lateral incisors as abutment teeth, leading to further problems and of course further recession in the area of the central incisor ponticus. If we lose the lateral incisor due to tooth loss or fracture, we now end up with a worsening of this conditioning that leads on with more tooth loss and more destruction, eventually going to a 6-unit bridge. So you can see implants are certainly the better option whenever possible to save your teeth.